Is it visible to all of you, my screen?
Yes, yes.
Yeah, thank you everyone. And it is a great feeling like I'm on this platform. And thank you so much for inviting me in second international conference on research methodology. And I'm very happy to be here, which is being organized by Dr. Shakuntala Mishra National Rehabilitation University, along with the Science Tech Institute, which is run by Manraj Kanwar Singh Educational Society. So I'm very thankful to all the organizing secretaries and technical committee here, and especially Dr. Sushil Singh and Dr. Dharmendra Yadav, who are working continuously and organizing lot of conference and lot of faculty development program. And I also want to congratulate Dr. Kaushiki Singh, Madam, who is the organizing secretary of this conference, Professor C.K. Dikshit, Sir, conference chair, Professor N.B. Singh, Sir, who is the Vice Chancellor of Srishti Language University, Lucknow, UP, and Professor Rana Pal Singh, who is Vice Chancellor of Shakuntala Mishra National University, and Dr. Praveer. So thank you all of you for creating such a wonderful platform where we all, like faculties and scientists, can connect and share our ideas. And we can learn many things, and we can also go back to our workplace, and we can initiate with those ideas. So today my topic is like I'm going to discuss about the fetomaternal outcome of pregnancy among the tobacco user in Chhattisgarh. So why tobacco? So tobacco burden in Chhattisgarh is more. As per the GATS study, we have around 39.1% tobacco burden in Chhattisgarh, where both male and female are using tobacco, which include smokeless and smoking product of tobacco. So number is very high, and we don't have any other study till date from the state of Chhattisgarh, like what is the pattern and what is what is the outcome of this tobacco users, if they are using tobacco from this time, or from childhood, or they started using tobacco from their adult age. So here in this is a very small study where we did the pilot study on only on the pregnant woman. Obviously no one has targeted on the pregnant woman, especially from the Chhattisgarh. So it is a pilot one, very small study where we have taken all the pregnant women and wanted to see like what is the pattern, what is the prevalence of tobacco use among the pregnancy, and what all are their outcome, like what all are the bad or good or whatever the effect on the female and the child. So looking keeping this thing on the mind, we started with this study. So first of all, it's introduction. My screen is not moving, I guess. Is it moving?
You can share it again.
I cannot see my screen moving here.
No, you can share it again. Yeah, now it's moving.
Okay, so to start with the introduction, like we all know, it is not a new thing. Like tobacco is dangerous for health, for not only for the pregnant woman, also for the healthy individual, whoever is having tobacco. It can cause cancer, respiratory diseases, and heart problem, and thickening of blood. So it is overall very harmful. And here we are going to target only for the pregnant woman. So tobacco use during the pregnancy constitute remedial risk for maternal and child health. There have been a lot of research, and they all been documented also. For the pregnant woman, this include the increased risk of obstetric complication, like a higher rate of spontaneous abortion, ectopic pregnancy, placental abruption, placental previa, premature labor, and preterm birth as compared to non-smoker mothers. And it also lead risk for the unborn baby, such as the low birth weight and small gestational age as compared to non-smoker. And prenatal maternal smoking is also associated with the increased risk of sudden unexplained death in infancy. Smaller head circumferences, delayed risk of respiratory problem, cancer, neurodevelopment, and behavioral problem in the child whose mother are having like exposed to tobacco during pregnancy or before pregnancy also. So here I will tell the quick profile of Chhattisgarh. The overall population of Chhattisgarh is 30 million, and we have 12.82% of SC and 30.62% scheduled tribes. So Chhattisgarh is a tribal area, and in tribes, what they do, they produce various local tobacco product, which is like it is being used, and it is not, they are not selling by brand, right? In market, a lot of cigarettes and tobacco product are available, but here if they are going to sell the local product, it is not getting sold by the any brand. These are the local one, they are just wrapping into the polythene and they are using it. So exact prevalence or exact use of the tobacco is very hard to identify. So here in this such kind of study, or the research which we are initiating from the state side, we are going to target that local product also. So it is having 33 district, block 147, and these number of villages, and educational institute. We going to target the educational institute also, because now the children at early age, 13 to 80 year age, children also like they are starting tobacco use very early age. So this is all the prevalence of tobacco use in Chhattisgarh as per the GATT study 2019. We have 39.1% prevalence of tobacco in Chhattisgarh. Current smokers are 5.5. Current user of smokeless tobacco is 36. Exposure to second-hand smoke at workplace 21.9%, and exposure to uh, second-hand smoking at home is 34.7, and exposure to any public place is 24.4%. So this is the tobacco use in Chhattisgarh. Again, here they have divided into only smoker and non-smoker, and smokeless tobacco use, and 60.9% are the non-users. So here again, if you see the figure 2, which is showing the prevalence of most commonly used tobacco product among all adults. So most use tobacco is being it is smokeless tobacco. It is a like oral tobacco application, that is around 19.7%. Khani is around 16.1%. Gutka is 7.8%. Bidi is 4.1%, and betel quid with tobacco is around 2%. So this is how. So here, not only the male, female are also using tobacco product, basically gudaku, which is a local product, and they are very much addicted to such kind of tobacco product, so they cannot quit during the pregnancy also. The females are like local in urban or in rural area, females are just putting that gudaku in their mouth, and whole day they are working and they are using this product. So keeping this thing in mind, we did this small study. So research question is, what all are the maternal and fetal health outcome of mothers being exposed to tobacco product during pregnancy? So here we have taken all trimester, like first, second, third, or previously, even if they are using the tobacco, those mother also included in this study. So hypothesis one is null, and alternative, there is no difference in mother or fetal after being exposed to tobacco. And alternative is yes, there is difference. So these are the aim and objective, like what is the prevalence of tobacco during the pregnancy, and what all are the fetomaternal outcome if the pregnant lady using tobacco during pregnancy. So objective remains same. This is the methodology where this is a cross-sectional observational study. Study duration is Jan 2022 to Jan 2023. Sampling method was consecutive sampling. And study tool was pre-designed semi-structured questionnaire. And study setting is PTJNM Medical College, Raipur, Chhattisgarh. Sample size, a total 1,250 females were admitted and registered for this study. Study population, all the antenatal and postnatal women were included for the interview. Sample collection was done during February 2022 to May 2022. Ethical consent, yes, as Dr. N.B. Singh sir were discussing, like it is an observational study, so no need to take the ethical clearance. No, it is not like that. Even if you are doing the observational study or any survey, you need to have the ethical with you for any kind of study. So the study was approved by the ethical committee of medical college, and after ethical approval, written consent was collected from the each of the participant, and then only we took the interview. So this was the selection criteria for the patient. All antenatal and postnatal women were included in the study. Exclusion criteria was patient on another type of adduction, patient with a history of major medical illness, patient with a history of major surgery in recent past, and patient with a known case of neurological and mental illness like anxiety disorder, epilepsy, depression, etc., and patient on other medication. So these are the study variables, independent and outcome variables. So no need to explain here. So these were the confounding factors which we could not exclude. So those are the additional addiction, STI, urinary tract infection, chronic disease like hypertension, diabetes, mellitus, and nutritional status of the mothers. And these are the result. So, like we have registered 1,250 women, out of 429 were the tobacco user, which is very huge amount. 34.3% women were using the tobacco during pregnancy. So here 959, like 76.7% of women were admitted in the hospital, which were more than 37 weeks, and 2% were less than 28 weeks. So again, this is because of tobacco use or any other, we need to look into it. Like it is like very 28 weeks, it's a very less time, the gestational period is very less. And again, if we come into next point, it is total 637, 52 male babies were born, and 593, that is 47.4% female were born, whereas the 20, that is 1.6, but the 20 newborn babies got aborted, which were from the tobacco users. And then again, coming into the next point, the 69.4% newborn had the birth weight of 2.2 to 3.5 kgs. That is okay, acceptable. And 4.5% baby were very healthy, more than 3.5%. But the 1.1% baby had very less birth weight, that is 1.5 kg. Obstructed complications were found in 431 pregnant female, that is 34.5% out of 1,250 women. So complication recorded in the tobacco user are preterm birth with other complications such as the PROM, low amniotic fluid, infertility, that is 18.40%, 3.20%, 3.30%, and 1.20% respectively, which were slightly higher than as compared to the non-user. Those were 14.30%, 3.20%, 2.90%, and 0.70% respectively. A significant association was found between the use of tobacco with obstructive complication with an APGAR score at 1 and 5 meter with the odds ratio 1.43 and 1.60 respectively. And again, tobacco users, there were 1.3 and 3.2% of the baby needed the NICU admission also, whereas the baby born from the healthy individuals, those were the 95.5% did not need any NICU admission. So it's a very small study which we had planned, but the further which we are going to plan, there we are going to streamline more thing, and we'll try to avoid the biasness also, because it's a pilot one. So we calculated the sample size for the long-term study based on this, and this study has been published in PubMed also, which we have done last year. So point of discussions are like, yes, we know the females who are using the tobacco is not good during the pregnancy, as well as for the healthy individual also. As per the GATS survey, although I have mentioned during, 2005 to 6 to 2009 to 10, there is a increased rate in tobacco use in the female, that is 25 to 25.2% to 41.6%. So it is increasing. So I don't have the recent data and the maybe the current years. So we can see that pattern also. So here the other research also indicated that tobacco use from the smoking or the smokeless, both are if any product you are using during the pregnancy, reduce the birth weight and uh, shorten gestational age and raise the risk of stillbirth. And also they link to premature membrane rupture, abruption, placenta previa, preterm birth, intrauterine growth restriction, and sudden infant death syndrome. So we also find the similar finding. Yes, there was the higher risk as compared to the non-user of the pregnant female. So according to some research, smoking cause, here it's given 50% of premature birth and 20 to 30% of the lower birth of baby, and 15% increase in overall perinatal death. So here we have not taken like whether the pregnant woman initiate tobacco use during the pregnancy, or they are using tobacco product like from the number of years. So a lot of things are missing in this pilot, which will be covered by into upcoming research. So we can tell you the exact picture more. We can come up with the more factual. What is the status here in Chhattisgarh? So coming into the conclusion, why we do research? Like one can say, like there is a number of data available. Yes, tobacco is harmful in pregnant female. Also, it is yes harmful. We should not use. But why? Why we need? We need because like in our Chhattisgarh state, we are using the different local product. Also, we don't know the actual pictures, right? Like what is the status of female or the male or the pregnant woman, how they are using, what is the burden. So that's why we are planning such kind of research, and we can get the, based on those research, we can get the more facts and the more accurate data, so that it will be helpful for the policy maker to make new policies or the guideline or the strategy to control the tobacco use in the state. And those policy are not only in Chhattisgarh, but in all over world. Based on the facts, research, we can frame such kind of policy. So despite of high burden of tobacco use in Chhattisgarh, very low research have been done to show the impact of tobacco among the pregnant female and its outcome. So definitely a longitudinal study or the research plan is needed, which we are already planning. Maybe in upcoming this year or the next year, we'll be having the exact data. What is the real picture? So yes, the study was approved, and this study was supported by the NTCP, National Tobacco Control Program, Department of Health and Family Welfare, Raipur, Chhattisgarh, India. Also, I forgot to mention NUHM. So it was supported by the NUHM also. And what is the steps of state? So step taken by the Chhattisgarh government, those are they are following the Empower strategy for the tobacco control. according to WHO. So where M is for monitoring the use of secondhand tobacco and prevention policy. P stands for protect people from the tobacco smoke. O, offering help to quit use secondhand smoke tobacco. Warn about the danger and harmful effect of tobacco. E stand for enforcement of ban or advertisement, promotion, and sponsorship of tobacco. R is raise the tobacco tax. So these are the strategy on which we are working so that we can control the tobacco use. We based on the awareness also, so that people can know the exact picture danger, because most of the people, they are not even aware like what is the danger, what they the people living in rural area, they don't even know like if they are having this much of tobacco use, they don't know like it is how much it is harmful. So we need to go, we need to train them, we need to uh, like go for the small camp also to spread the awareness also. So here our state government is working on this study. They are giving the training also, and working on that WHO strategy. Here they have created one tobacco monitoring app also to control the tobacco, where they are having two interface. One is for the enforcers and one is for the educational institute. So for enforcers, where the state government people, district or the blocks people are like they can, if they are seeing anyone to use the tobacco or they are smoking at the public place, they can register here in this app, and they can uh, like they can raise the complaint also against them under the this CODPA Act, that is 2003. And for the educational institute, where the principal and head, they are also this is the tobacco monitoring help, where they are spreading the awareness among the children. So there, by this platform, they are being trained and spreading the awareness, like to not the use tobacco any shop, if it is near to a school or something, it should not be there. So such kind of awareness being done by the state government. And future research plan, also it is this study is approved by ethical committee of medical college. It is an epidemiological study on consumption pattern, perception, sale, and access to tobacco product in population of Chhattisgarh, where we are going to cover the six major elements. Those are the tobacco consumption pattern in Chhattisgarh, knowledge, perception, and attitude, accessibility to tobacco use under age 18 years, tobacco use in tribal population, and tobacco sale. So this is all where we are working uh, in control the tobacco use in Chhattisgarh. And that is all from my side. Thank you so much.